Steve Sumner's 11-9-24. Unit 2 Cases. Case 2. A 16-year-old female is recently diagnosed with a deficiency of muscle glycogen phosphorylase. She and her family are concerned and ask the following question. Based on what you know about skeletal muscle glycogenolysis and muscle metabolism, please respond to each question with a thoughtful answer. Can you explain how muscle glycogen is used normally during exercise? Can you explain how muscle glycogen is used normally during exercise? Glycogen works in the muscles by providing energy directly for the muscle itself to contract during physical activity. During exercise, your body tries to use all of its energy sources, including fat and glycogen. First, it prioritizes using glycogen saved in your muscle and liver since it's easier to break down than fat. During intense aerobic exercises where your body transports oxygen to your muscles, readily available energy is ideal, which is glycogen. And if you're exercising longer than an hour, the muscle glycogen is probably used up, so it will then access free fatty acids and blood glucose for energy. To generate more glucose, your body will begin gluconeogenesis. This is the process of converting non-glucose substrates, such as fat and protein, into glucose to be used for energy. This process is anaerobic, meaning that it does not use oxygen. This is a less efficient pathway when compared to aerobic exercise and creates less energy. With a lack of muscle glycogen phosphorylase, glycogen cannot be metabolized and builds up in the muscle. With a lack of muscle glycogen phosphorylase, glycogen cannot be metabolized and builds up in the muscle. If glycogen is not metabolized, this leads to low stores of ATP, which can lead to muscle failure and injury. I really like to take long walks. Will I still be able to do this with my friends? You should be able to maintain light to moderate exercise. You may notice that you need to take a break during a long walk. It's better to keep active, but try to avoid high-intensity exercises, which may cause pain or muscle cramping. As a result of this deficiency, will I need to get up at night to maintain my blood glucose levels? No, I do not expect your blood glucose levels to be an issue. The primary issue with this condition is not being able to properly break down glucose for energy. The mechanisms that maintain blood glucose are still functioning properly. This is primarily the pancreas, which releases glucagon to keep blood sugar levels from dropping too low. Do I need to worry about producing excessive amounts of lactate during intense anaerobic exercise? Normally, glycogen is broken down by glycogen phosphorylase, which leads to pyruvate. If oxygen is present, pyruvate is then oxidized in the citric acid cycle. Or in anaerobic conditions, pyruvate converts to lactate. Since this chain is impaired, I would not expect an excess of lactate. Intense exercise should be avoided due to a concern of muscle damage. The best course of action is light to moderate exercise. Case 4. A previously healthy 2-month-old female presents with jittery spells several hours after breastfeeding. Her mother reports that she has not given the baby anything to eat other than breast milk since birth. The baby only recently has been sleeping for more than 2 hours between feedings, and that's when the mother reports these symptoms started. Laboratory results are consistent with hypoglycemia, low blood glucose, but are otherwise unremarkable. Epinephrine is administered and there's no increase in blood glucose, but there is an increase in blood lactate. Physical exam reveals a liver etch 4 centimeters below the right costal margin. Percussion of the right chest and abdomen confirms hepatomegaly. Blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range during fasting. Based on the information above, which of the following is the most likely diagnosis of this patient? A. Hereditary fructose intolerance. B. Galactosemia. C. Glycogen storage disease. Or D. Glucose 6-phosphate dehydrogenase deficiency. The most likely diagnosis of this patient is glycogen storage disease. During fasting and low available energy, the body would have trouble retrieving energy in the form of glucose, since the glycogen has not been stored. Epinephrine is a signal for cells to release energy. If glycogen storage is impaired, there will not be energy available and blood glucose levels would not be expected to increase. As far as hypoglycemia, storing glycogen is impaired, so glucose cannot be released when needed, causing low blood sugar levels during fasting. With an epinephrine signal to release energy and no rise in blood glucose, additional lactate would be produced as an alternate source of energy. And as far as hepatomegaly, due to glycogen not being stored properly, there is a buildup in the liver which will cause the liver to increase in size. Now we will take a look at a grid of possible diagnoses and the signs and symptoms to help make a decision. Hereditary fructose intolerance does not make sense since fructose is not a component of breast milk. Galactosemia is an inability to break down galactose, one of the components of breast milk. The other component in breast milk is glucose, which would still get stored as glycogen, so I would expect epinephrine to cause an increase in blood glucose levels. Galactosemia symptoms typically show within the first few weeks after birth. This 2-month-old was presented as previously healthy. So that gives us a no in this column. Glucose 6-phosphate dehydrogenase deficiency leads to a lack of NADPH, which is needed for red blood cells to function. This can cause a low red blood cell count due to the cells breaking down. The result is the child has difficulty getting oxygen efficiently where it is needed. Glucose 6-phosphate dehydrogenase deficiency is not related to fasting glucose levels. So that leaves us with glycogen storage disease, which checks all the boxes for signs and symptoms.